Let's get started. So, hi folks, my name's Raymi Doyle, and I've been a therapist working with neurodivergent individuals since 2005. I'm not going to give you a whole history of me, but you can check my website, www.thespacebetweenus.co.uk, where there'll soon be a chronological history of myself. It's currently being worked on. But today I'm here to talk about the culmination of the findings of my doctorate research, which took me 12 years to complete for many reasons. First, it was self funded, which meant I had a balanced work alongside my research. But secondly, like many in this field, I too realized I'm neurodivergent somewhere along the journey. And I wanted to come up also with a research methodology that ensured I was not further adding to potential misinterpretation and misrepresentation of neurodivergent individuals. Hopefully, everybody can hear my accent okay, so I apologize as Northern Irish accents that can be a bit harsh. But these all presented challenges, but essentially enhanced this research, as it was a qualitative piece of research that employed the evolution of my own reflexive understanding of my own neurodivergent way of being. It also gave me an understanding of how the academic literature was changing and still is, thankfully. And it also allowed me to tease some of the findings out with clients I was working with. And I have to say, clients I worked with often seen my neurodivergence before I did. And it was more holistic individuals that were people who questioned if me identifying as neurodivergent, which is a common experience, I believe. But I'm hoping you can see that while this, oh sorry, I designed a variation of a co-constructivist grounded theory, but varied it in a way that it's a methodology in its own right, but it needs more application. But what was interesting was the methodology informed the theory and this conceptual framework, and the theory informed the methodology. And I'm not supposed to call theory yet, but I'm working on that. So, like I said, I don't have time to go into the whole element of that, but I wanted to give you enough to see how the research shaped me and how there's multiple journeys going on here. Okay, so what's the core learning objective summarized here? Well, I want to give you what neurotransception is in a nutshell, and then understand internal and external reactions and the implicit and explicit power dynamics that fuel them. And I'm going to use the therapeutic dyad as an example, but it's relevant to most dyads in professional and neurodivergent relationships. So, quick disclaimer, this is a simplified relational overview. Not every interaction involves this process, but the potential is always there. So think of this, like I said, neurotransception in a nutshell. So the slide is focusing on these top two circles, first of all. And the core idea is we are constantly unconsciously gauging safety in our interactions. This process of evaluating risk and safety between neural pathways, according to Stephen Porges, is neuroception. So Porges' polyvagal theory suggests that the ventral vagal system, part of the mammalian vagus nerve, supports social engagement in how we interact, growth and restoration of calm states, which are necessary for maintaining homeostasis. Now, for me, homeostasis is a very important concept, which essentially means to create an internal balance within, whereas allostasis is another important concept to maintain a balance between homeostasis within and the external environment, which includes other. Now, when neuroception detects cues of safety, the ventral vagal pathways become active, allowing the body to achieve and maintain a state of homeostatic regulation. So, safety is felt when both internal and relational balances are achieved. And we maintain these balances by excitatory and inhibitory processes within homeostasis, but I also believe it happens externally as well. So, how we signal safety, we use implicit and explicit cues like facial expression, smiling, eye contact or not, affect, and small talk to read and broadcast safety signals. When individuals enter space, they may smile to their neighbour, engage in some banter, as we say in Northern Ireland, or experience a warmth from someone's eyes, just feeling that presence. Now, the term neurotransception, transception between relational neural pathways between both individuals. So we have looked at the individual experience in this, but I'm interested in this relationally. So relationally, we have this mismatch between signals receiving, which is focusing on these next two circles. And you can see the red dotted line over transmitter talking about neurotransception. For this concept, I'm referring to the autistic individual as receptor and the neurotypical non-autistic as a transmitter regarding the exchanging of signals. And that's why I'm using this term just to make it easier to understand. As the neurotypicals are from the more common neurotype, from an evolutionary perspective, currently, I'm going to add that word. So the non-autistic transmitter often operates from the dominant neurotype being the most common. So are often sending the signals out to test if the space is safe to interact in, which is part of what occurs in a social hierarchy. Now, social hierarchies like these have existed across alpha and beta relationships throughout our evolution. So when the person transmitting the signal does not receive a signal back, or a signal they may not be able to interpret, then there's a space of unknown for the non-neurodivergent, aka the neurotypical. So the autistic receptor experiences the world differently due to factors like sensory sensitivity, monotropic thinking, traumatic experiences. Autistic individuals may also experience everything at once, a vast amount of data, both spoken and unspoken, so they may not always pick up the signal. Or they might send the signal back in a way that neurotypical people may not be able to decipher. So this means the non-autistic transmitter system relies on ego to manage disruptions, justify decisions, and make quick predictions to reduce uncertainty, like the uncertainty they're experiencing when they're not getting a signal back. Now, in the predictive brain theory, Friston said the brain predicts what will happen next. A prediction error occurs, and then when reality doesn't match that prediction, then the idea is to reduce the prediction error. And I believe its ego is used to make decisions, and it used to make decisions to resolve and reduce the prediction error. However, ego's attempt to rebalance the imbalances from a place of unknown, which means that the non-autistic transmitter's ego uses context to make shortcut predictions, which I believe is a reverse context blindness. And I named this in my research as such. So these shortcut predictions are intra, not intersubjective, and interrupt relational dynamics to justify, and when they become intrasubjective predictions, they are projections from the neurotypical of what they think is occurring. Now, when I asked Stephen Porges at a conference how he described projections, he said it was a misaligned top-down interpretation of a bottom-up experience, as opposed to vice versa. So this misaligned top-down interpretation of that bottom-up experience was an attempt to reduce the prediction error between self and other. And when the non-autistic transmitter's self, there was an incongruence growing between what was experienced from a bottom-up fear of not getting the signal and a top-down attempt to reduce the prediction error. So the neurotypical has this incongruence often in the communication. The autistic receptor, if they're picking up that signal, they're experiencing the misalignment of the non-autistic transmitter as two different languages, and that was actually named by several individuals in my research. They felt like that the messages they were getting were mixed messages constantly. When the non-autistic transmitter is seeking safety, the conscious or unconscious systems may not realize there is an incongruence within their signals. Again, some people would say that's a reverse mind blindness, which the autistic receptor's conscious unconscious signals or systems receive and interpret as exhaustive and confusing, maybe because the hypersensitivities as well as other autistic and neurodevelopment individuals experience. So I think of the idea of Spoon's theory gives a good example of that. If the non-autistic transmitter had a more open loop signal where they had the capacity to receive the signal of the autistic individual as a transmitter, they may be able to receive feedback that the signal as non-autistic transmitter is confusing. However, here's the dilemma. Since the non-autistic transmitter has an activated intersubjective ego, so they're trying to justify that prediction error, and they go, oh, it must be this, it must be that, and they're projecting their internal experience onto the other because of the misaligned between top-down and bottom-up experience, and a perceived lack of signal response, and the predictive brain and using ego to reduce the prediction error, a threat response can be activated in the non-autistic individual as a way to cope with this dilemma, which can be both consciously and unconsciously be experienced. And I am guessing or suggesting that this give at least one explanation for Damien's double empathy problem, which he's mentioned and has been very well discussed. So an example in my research was a care assistant experienced an incident of hair pulling with an autistic individual with severe learning disabilities and called the police. And being from the small community, the parents were ashamed from the commotion, and the focus then was on everybody's discomfort except the autistic individuals. They weren't prioritized at all. A few days later, the autistic individual went into shutdown and disconnected. So here, the care assistant had a closed intrasubjective loop where they perceived and interpreted the autistic individual's behavior as aggressive towards them, called the police as opposed to seeing them. This individual in distress. The care assistant's intrasubjective ego may have inadvertently misinterpreted what was a distressed autistic receptor requiring support and help. So what happens here? Well, the autistic individual, we're setting them up to be able to not to be able to respond to a situation like that. And we're also interrupting the autistic receptor's individual journey of self, which you'll see what I'm pointing to here, leading to internal reactive positions. Now, I say we all have individual journey of self. What differs, though, for many neurodivergent individuals is the interruptions they experience within relational dynamics. They are far more. The autistic individual's journey of self is not something we have time to go into in detail today. I will discuss this more as I open up more of my research and present more on this and write on it. But except they're a natural progression to where they want to be in life, which when the individual receives necessary support that is not interrupting their journey but enhancing it, often leaves them to have fulfilled lives, not from someone else's perspective, but from theirs. I think this is one of the benefits of us working now with more neuroaffirming language and trying to get away from the medical model. So, when the autistic, when constantly met with incongruent signals and projections, autistic individuals as receptors develop protective internal reactive positions. So some of these are, and I'm just going to quickly touch on these, underselving, a diminished focus on self, and an over-focus on others, which may lead to a blurred sense of self. One person in my research said, I can't tell where I begin and they end. Over-othering, hyper-focusing on the other person's state, which becomes draining, especially when the other is incongruent. Again, think of the two different languages and that hyper-focus on both of them at the same time. Dissociation was zoning out as a peripheral buffer, not to manage sensory and allostatic overload. So it's not necessarily just a traumatic response. It's a regulation strategy. And this one I need to look at more, but pattern-seeking brain entered a functional freeze, seeking patterns to create predictability and prevent further overwhelming neurotransception, which can lead to inertia. So regarding trauma responses, the concept of autistic individuals having increased threat detection to down-regulate the prediction error may be part of neurotransceptive reactive positions where fear was learned. For example, if you're more threat responsive, you can prepare for the threat better, but then your systems are threat orientated. So traumatic responses as reactive positions has been referred to as autistic defenses by a number of researchers. Also, the concept of the autistic individual having to try and find homeostasis and allostasis meant sensory stimuli were adjusted to reduce the prediction error, but then could leave the autistic individual traumatized from both internal and external origins. I believe Shore talks about internal trauma in some of his works. So shame responses, this could be where autistic individuals don't have intrasubjective ego compared to their neurotypical to project to warn off shame. So with autistic receptors having less ego defenses to project the shame onto other, this could be recorded within the psyche as a fundamental flaw. Not saying it is a flaw, but it's recorded within oneself as a fundamental flaw of self, which was suppressed and manifested in the body, which may be more related to the dynamic that has occurred rather than the individual's shame itself. And a person in my research said, what I've written down about shame in my therapy, let me quote, notes is, it isn't about the wrong thing you did, it's that you are wrong as a person, which I thought was quite interesting in that. Now, if we think of this inhibition and excitatory relationship between homeostasis and allostasis, that is the inhibition and excitation between self and other, the eternal reactive positions, the relational dynamic, and when you turn one up and turn one down, it's more fluid. And the fluidness are attempts to protect the integrity of the self in the face of the relational misalignment. Again, the double empathy problem. But they also can become complicated when one's neurodivergent ways of being becomes exacerbated from those relational dynamics. I have always had a hypersensitivity to sound, but it was never caught on because I only get it when I'm in stressful situations, and I don't always recognize stress within my body until it's too late. So the next slide is focusing on external reactive positions, which is related to the next three circles. And the neurotypical transmitter also reacts. Their external reactive positions are reactive, intrasubjective projections imposed onto the autistic receptor. So through the non-autistic individual needs to minimize the prediction error, which was increased with this unknown space I talked about earlier. The non-autistic transmitter may react to the lack of response and to what I've labeled as external reactive positions, as they are reactive to the transmitters, whether conscious or unconscious, but they are external to the autistic individual receptor. They are intrasubjective because they are imposed perceptions. So external reactive positions, I jumped there. External reactive positions were often bottom-up processes leading to the transmitter's sense of threat, which also activated a social dominant status within the transmitter. And this takes us into the realm of power dynamics and hierarchies. So social dominance here may be a default mechanism to regain control whenever the neurotypical individual who is identifying as a dominant, the most common neurotype, at an evolutionary perspective, not necessarily as a conscious one. So one person, and I'm sure we can think of lots of examples of this, but a person said in my research, he was an autistic therapist in training, and he said he was told he had to use the term person with autism. And he said they can't identify with that. He says, never mind, forget about whatever you believe or disbelieve. I just can't identify with that, and I want to be called an autistic therapist. And he said, or autistic individual. And they said, no. And again, this was imposed. I'm sure we can think of lots of examples. So moving on to the purple circle here. These power dynamics leads to what can be described as a fixed mentality. I think to ask every neurodivergent individual, there is this concept of why is this fixed mentality constantly going on? Well, the neurotypical individual attempts to fix the autistic person, not for the autistic person's benefit. And this is why it's seen so as coercive control, but to reduce their own internal prediction error and control. Again, I'm generalizedly speaking this. By framing the autistic individual as broken, they're not, but I'm saying by the system of the neurotypical doing that, they are able to justify their own actions and reaffirm that hierarchical position because the unknown brings them down in the hierarchy. So fixing essentially becomes a way to resolve their own discomfort. Examples could like pejorative language, compulsory social skills training, normalizing interventions, subtle microaggressions, you don't look autistic, assuming incompetence due to diagnosis, questioning the autonomy of the autistic individual, and we could go on. So the function of shame also could be promote adherence to social norms and maintain group cohesion, and which can also be an external reactive position where the neurotypical shames the autistic individual or neurodivergent in trying to promote their perception of what is occurring. And I believe this is one of the reasons why neuro individuals often feel gaslit. I know I have. So imposed power can also come from a positive space. While this may manifest as people trying to do good, but it's actually the autistic individual on the surface, but it can be related to more complex power dynamics. Someone in my research called them well-intentioned agents, which is people trying to do their best, but they're making a real hames of things. So I was going to summarize it, but I'm going to skip the summary for time. And I'm going to go on to a little bit, just a few minutes on this here before going to questions. So implicit power examples. Role-based authority. I want to take a look at this is in terms of therapists who are in a therapeutic dyad. If you think about it, therapists are perceived as authority figures due to their professional training and expertise. Also, information balance. Clients reveal deeply personal information while therapists maintain more privacy, creating an asymmetry in vulnerability and knowledge. Power to name. Therapists have the authority to diagnose or label a client's experience, which can influence their self-perception. And the process is context-dependent. Reframing a client's experience is related to how one perceives the reframing. Cultural authority and social status. Therapists may hold cultural authority by virtue of their respective profession, which can lead to clients to defer to their judgment. And this dynamic can foster a sense of inequality, which leads to those internal reactive positions and over-othering. Non-verbal communication, the therapist's tone, posture, body language, actually can be subtly communicating dominance or authority if they're not aware of that power dynamic, that they not be even consciously aware of what's occurring. Transference and countertransference. Implicit power dynamics, we could go into this in so much more depth, but just saying that transference is where the client projects past feelings onto the therapist, and the countertransference where the therapist projects their own feelings onto the client or into supervision and whatnot. The therapist is a gatekeeper. Therapists often control access to healing and understanding through their interventions and feedback. There's a risk of imposing one's perception of the client's needs, particularly with attachment of trauma-based wounds, which may be misinterpreted as part of reactive positions. This is why it's so important to look at the relational dynamic, because we often look at these as, labels, and we're forgetting this is all part of relational dynamics. The therapeutic environment, the setting of therapy, where the therapist controls the space, time, and setting. And then finally, explicit power refers to the overt or clear authority influence of the therapist hold in the therapeutic process. For example, expertise and authority. They're trained mental health professionals hold authority in the treatment process, possessing specialized knowledge in psychological theories, diagnoses, therapeutic techniques, control over the process and the decision making. The therapist guide and structure of therapy, setting session frequency goals and therapeutic approach. They make key decisions and interventions, techniques, which also reinforce power. And confidentiality and boundaries. Therapists define confidentiality and professional boundaries, yes, from their professional or their professional license or professional group that they're connected with. However, therapists also mandate reporters, and even doing that can decrease power dynamics. So, very quickly, where to next? There's a few things I'm currently developing. I need to translate neurotransception as a standalone therapeutic approach, and it can be integrated along other therapeutic modalities, and I've been working on that quite a bit. Generic ways in working with power dynamics across all professions. Neutralizing that power dynamic is a chance to open that up. And I looked at that in my research. Integrating trauma, shame, and other reactive positions as a relational dynamic rather than these individual experiences outside a vacuum. Integrate neurotransception and clinical supervision models, explore some of the neuroscience and understanding of the evolution, and also look at maybe how this inhibitory and excitatory experience can exist both across homeostasis and allostasis. And I am interested in how intersubjectivity as a central theme can help us understand all of the above. And I'm just going to leave that last slide as a quote. And my website, just Google me, and I'll be doing more on this. Thank you. I'm open for any questions now.
Thank you, Raymi. That was absolutely fascinating. Lots of comments in the chat. I'll just go through see if we've got any questions, but lots of comments. Yeah, so Damien, the non-autistic threat response is interesting. Another factor is that the non-autistic person is not as used to having such breakdowns in mutual understanding as autistic people are, and I guess then the threat is raised. Some discussion about microaggressions and the term as experienced as an attack. Often the person doing it is unaware, and then intentionality is important in that. Can I ask a question about the I wrote lots down, Raymi.
About people feel free to ask them later, because I will answer emails as well.
Lovely, yes, thank you. That might be something that people go away and have a think of. But you mentioned briefly about internal trauma.
Yes. So if you think about it, yeah, Shore wrote about this, but he didn't refer to neurodivergent individuals. And he talked about how the system can have an internal trauma, but he didn't go into any detail. And what I looked at was the idea of someone having these internal reactive positions. So if my journey of self is interrupted, I'm on my way doing what I want to do, and now I'm having to readjust because there's something going on in this dynamic. And in that dynamic, I am now dealing with a heightened level of stress. The heightened level of stress then impacts the monotropic thinking, the sensory impact on the body, also a number of other things going on, there's a difference in delay in processing. So all of this is going on, and I'm still having to try and interact in that space. So the internal kind of, the body's under threat. And that is creating this internalized trauma as opposed to an external event creating the trauma. And sometimes it is that's why it's important part of a relational dynamic. There is the internalized experience, but that's then still part of this external dynamic. And that's where it gets quite complicated, because everybody wants to look at the individual experience rather than, not everybody, not us here, but quite a few other professionals and researchers. Does that explain that?
Yeah, wonderful. Thank you. Yeah, really. And it was Shaw, did you say? I'm going to have a look at that.
Yes. Basically, I can get the reference. He did write a theory on autistic experience, which is outdated, very much outdated. But he's a neuroscientist, and basically, again, I can stick the reference if anybody wants to email me. His stuff is. Yeah, it was, and again, I need to find. I forget. I think I wrote it in my research. It'll be in my thesis. I just need to find it out.
Okay, wonderful. I don't know if you can see any other questions, Damien.
I'm not getting any questions. Sorry, because the chat only shows. Let me. I've got it. Sorry. I was under Read AI.
You've generated lots of dialogue, lots of kind of lots of thought and conversation.
I mean, there's a tangent conversation a bit around the term microaggressions and whether it's a good term or not, because it suggests intention.
I guess the term for me is it's subtle, and some individuals aren't even aware of it. It's that idea of the concept of well-intentioned agents. I love that term because it was kind of saying, but we had a problem here in Northern Ireland, and I'll just give a quick example. It's not to do in neurodivergent, but there was a politician who couldn't understand the concept of white privilege and just couldn't fathom it. And it became quite famous. Somebody tried to explain and says, but I'm not racist. It's just that kind of like, there's such an innate lack of understanding of how it can be a relational dynamic. That's what I'm finding. And I think that also transfers over in the neurodivergent world. It's this, but that must be your neurodivergent way of being, and saying, no, this is actually part of this relational dynamic that is actually enhancing. And some of this stuff is yours. This isn't mine, but yet you're projecting it onto me. And again, that's just the idea of the fear of the neurodivergent minimizing that prediction error. And if they can't, sorry, the neurotypical, if they can't reduce that prediction error, then we've got to kind of, they go lower in the hierarchy and they have to bump themselves back up in the hierarchy because of the social environment where the most common neurotype is seen as the higher in the social hierarchy. Again, that's theoretical rather than factual, but it's what came from my research. Thank you, Caroline.
There was I'd had it first, a comment from Joe. Oh, there it is. So Joe mentions it is interesting that Mary Doherty is also looking at shame as a factor in autistic trauma, and seems that shame is a major theme for our Irish colleagues. So whether, I don't know whether that is something you see recurring, Raymi.
Shame is something that I wanted to write more about, but I had to be selective. As people will know, when you go to put your thesis in, you'll have like 4 times more than you want. 12 years, so I was like, oh, I want to write about this, and I had to be really selective because that was just too big a topic. It is something I have more information on. I just couldn't write a lot about it on it in the thesis itself. But yeah, I think that the shame as an internal and an external reactive position, and to me, the interest is, if you think about it, shame is we don't want to do that. We want to change something. And the idea of the ego, if neurotypical, if somebody has an ego, they can offset shame. Oh, that happened because of this, and this happened because of that. So I'm no longer should be blaming myself. And I can offset it onto the environment or someone else. But if you don't have that ego strength, that's the term. I'm not saying people don't have ego, they don't have ego strength. And that's what I found with a lot of the authenticity between every neurodivergent person I've ever spoke to, include one I relate to, try to be very much authentic because I cannot not be authentic in my way of being. To me, it's kind of like if I do anything different, it's really fake and just doesn't make sense. And I just lose where I am in that. So I don't have that kind of ego strength. And I'm saying, I think other people are the same. And that bit can then lead to an internalizing of shame. And then the other bit being the external reactive position, shaming the other person to gaslight them, to then bring them down in the hierarchy. And that's where I'm interested in them 2 areas, if that makes sense. But again, I need to explore it a bit more. Sorry, Damien.
I was just going to mention quickly one of the influences on my thinking on the double empathy problem was a theorist called Harold Garfinkel. You've heard of him. And he wrote about breaches and breaching experiments he came up with in the 1960s, which breach social norms to see how people react to them. They eventually were said to be unethical to perform academically in research, but you can see a lot of it in comedy, like Dom Jolly or Beadles About, these kind of breaking of things and then record the reaction and so on. But what Garfinkel found was when there's such breaches in expectations, people tend to fill the gap as quickly as possible. So it's like, oh, that person didn't return my greeting, my wave across the road because they didn't see me, or they're in. Do you see what I mean?
That's the prediction error.
It's trying to adjust to so there's not an error anymore, at least in your own head. Because what the real reason is, most of the time, people don't have a clue. So it's just what fits. with their current thinking. So it kind of smooths over those breaches and breakdowns a bit.
It
And
takes away the discomfort.
yeah, so it's interesting how you're sort of picking up on a similar issue, but using different concepts and terms within it. So there's quite a lot there, I think, in terms of, prediction errors and what we do when encountering sense interactively. So I think we better move on those because we are running a bit over time. But if you want to carry on in the chat, or I'm sure you can message Raymi afterwards as well.
Of course, without a doubt. Feel
Thank
free.
you, Raymi.
I'll stick my email in the chat.
Thanks, Raymi. I'm sure that these conversations will. So we better